This is a Kidney 360 podcast, and we are Yosef Haviv from Soroka University Medical Center and the Ben Gurion University, Be'er Sheva, Israel, and Eliezer Golan from the Israeli Dialysis Registry and Tel Aviv University, Tel Aviv, Israel. Kidney 360 hosts a series of global perspectives designed to highlight the international differences in the medical management and financing of various topics in clinical nephrology. We're speaking to you today about dialysis management and funding in Israel.
Yossi, let me ask you a question. Given that the PD is more profitable than hemodialysis in Israel, how do you explain the dramatic decrease in PD utilization between 1990 and 2015?
Well, Eli, this is multifactorial. First, the fastest growing group on dialysis are the elderly, those older than 75, and their motivation for independence and self-care has plummeted. For this age group, home dialysis may be undesirable, and living home to a community-based dialysis center is often a way to socialize. Second, some patients, especially those living with their children, do not wish to bring home the disease. Next, the development of multi-resistant bacteria has become a growing cause of premature termination of PD in some patients. Last but not least, for many patients, the availability of nearby private hemodialysis units outweighs the benefits of PD. In this respect, it is our duty to offer every ESRD patient the full spectrum of renal replacement options. Now let me ask you, Eli, despite the availability of universal health care in Israel, only half of the patients starting dialysis have been seen by a nephrologist in the preceding 6 months. What accounts for this observation?
Well, Yossi, this is also multifactorial. The medical system in Israel is based on the family physician who is the case manager and is supposed to refer the patient to specialists. Referral to the nephrologist depends on the decision of the family doctor, and there are no mandatory guidelines in Israel regarding the timing of referral. On the other hand, the number of active nephrologists in Israel is very limited, so that the wait time for meeting a nephrologist are very long. In addition, nephrologists in Israel also treat hypertension, and that reduces their time to treat patients with advanced CKD. Beyond that, there is no official policy of the Ministry of Health in Israel regarding nephrology in Israel. Yossi, let me ask you a question. About 1/3 of the prevalent hemodialysis patients in Israel use dialysis catheter. What explains the high catheter rate?
Israel has one of the highest rates of elderly patients on dialysis, many of whom have either a calcified vascular tree or congestive heart failure or both, thereby resulting in a low chance for a successful permanent vascular access and a relatively high catheter rate. Another driver for this relatively high catheter rate comes from the difference in resource allocation between the center of Israel and the periphery in the number of vascular surgeons who are dedicated to dialysis vascular access. In conclusion of this podcast, the last 2 decades have seen a major changes in the demographics of dialysis patients in Israel, as reflected by older and sicker patients on hemodialysis. Vascular access and the unplanned onset of dialysis remain major problems that need to be addressed by better nephrology clinic follow-up and incentives for vascular surgeons committed to dialysis vascular access, especially in the more rural areas. Thank you for joining us for this Kidney 360 podcast.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.